Strength, balance, endurance, and confidence don't automatically reset just because the joint has been replaced. It's not a magic surgery. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle, and I'm really glad you're here. If you've ever found yourself wondering whether you're waiting too long for a knee replacement, the question usually shows up wrapped in very real concerns about time. Time until the knee wears out. Time until recovery might get harder. Time spent managing symptoms versus moving on to something more definitive. For many people, it also comes with a very direct question. Do I actually need a knee replacement at all? Or is this something I can continue to manage without surgery? These questions don't come from overthinking. They come from trying to make a decision that will affect how you move, how you live, and how you feel about that choice years down the line. A lot of people take these questions straight to their surgeon. They'll say something like, "I'm not sure if I'm ready yet." And often the response is well-intended, but sometimes vague. "You'll know when you're ready," or "you'll come back when it's time and ask me for a knee replacement." For some people, that feels reassuring. For others, it can feel frustrating because knowing you're ready isn't always obvious when you're the one living inside the decision. And being told to wait until it's crystal clear can leave people feeling like they're supposed to recognize a moment that doesn't actually announce itself. What makes this decision hard is that there isn't a single right timeline that works for everyone. Knee replacement decisions are deeply individual. They involve weighing real benefits against real trade-offs, both now and in the future. And regret on either side of the decision is something many people want to avoid. So today, rather than telling you when you should or shouldn't have surgery, I want to help you think a little more clearly about how to make this decision for yourself. Not by pushing you in one direction, but by giving you a way to weigh what waiting is giving you right now against what it might be costing you, based on your body, your daily life, and what you want the next few years to look like. A helpful way to frame this decision is not in terms of time, but in terms of readiness. Readiness as a practical description of where your body and your physical capacity are right now. What tends to matter over time is whether waiting is helping you maintain strength, confidence, and options, or whether those things are gradually becoming harder to hold on to. And readiness isn't about how much pain you can tolerate. It's not about your age or how dramatic your x-ray might look, or whether you're tough enough to push through. Readiness is about capacity. It's about what your body can still do, how confident you feel moving through your day, and whether you can maintain those things while you wait. As I talk about readiness, you may already have a sense of which direction your own situation leans. For some people, waiting feels steady. Things are limited, but they're holding their ground. For others, waiting feels more like slow narrowing, less strength, less confidence, fewer choices than there used to be. Not because anyone did anything wrong, but because that's often how chronic joint problems unfold over time. So let's start with the version of waiting that often works well. For some people, waiting is active. They're staying engaged in movement that matters to them. They're maintaining strength, even if they need to modify how they do it. They still trust their knee enough to walk with purpose, to manage stairs, to travel, to participate. Their routines may be adjusted, but they're still doing the things that matter to them, walking where they want to go, managing daily tasks, traveling, socializing, and making choices based more on preference than on knee pain. If that's you, it's worth pausing and noticing what you're doing right. You might ask yourself, am I still choosing movement, even when it takes planning? Do I feel capable of rebuilding strength if I need to? When I picture recovery in the future, does it feel challenging but possible? For some people in this space, waiting isn't passive, it's intentional. And we're not guessing about this. A 2025 clinical commentary led by Brooke and colleagues reviewed decades of evidence on exercise and knee osteoarthritis and found no evidence that appropriately prescribed exercise accelerates joint damage. Instead, exercise therapy was consistently associated with better physical function and symptom management, even in people with established arthritis. In other words, movement doesn't wear the knee out faster. It's one of the main ways people preserve strength, confidence, and options while they wait. Waiting like this doesn't close doors. It often keeps options open. But there's another kind of waiting that tends to look very different. This is where readiness can start to slip, not suddenly, not dramatically all at once, but gradually. It often begins with small changes that feel reasonable at the time. Walking a little less, choosing the elevator instead of the stairs, avoiding uneven ground, letting strength-based activities fade because they feel uncomfortable or tiring. None of these choices are wrong in isolation, but over time they can add up. If you're listening and wondering where you fall, I'd invite you to reflect, not judge, just notice. When was the last time you felt strong in your legs? Do you feel steady when you change direction or walk in a crowd? Are you modifying activity but still doing them or avoiding them altogether? Does your knee feel limited but trustworthy or unpredictable and guarded? This is where research helps explain something many people sense but can't quite name. Long-term studies following people after knee replacement give us a fairly consistent picture of how recovery unfolds. A large longitudinal systematic review published in 2025 by Orange and colleagues pulled data from cohort studies tracking people over time, and they found that the biggest gains in patient-reported physical function typically occur within the first 2 to 6 months after surgery, with the rate of improvement slowing substantially after that. Registry-based work, including a study by Canfield and colleagues, has shown a similar pattern, with most measurable improvements leveling off by around 6 months and relatively little additional change between 1 and 2 years after surgery. And that early recovery window carries a lot of weight, and this is where pre-surgery status starts to matter in a very practical way. An earlier prospective cohort study by Fortin and colleagues followed people for up to 2 years after hip and knee replacement and found that those who entered surgery with worse functional status continued to function at a lower level years later, even though pain improved. And more recent health system studies have echoed this pattern. Large analyses led by Minnick and Kaplan, tracking outcomes in more than 12,000 people after knee replacement, showed that even with standardized high-quality rehabilitation, a meaningful proportion of patients did not achieve clinically important improvements in function. Across these studies, the common thread is not age or x-rays. It's where people are starting from physically when surgery happens. In plain terms, this means the surgery reliably takes care of the worn-out joint, but it does not automatically restore everything that was lost while you were protecting that joint. If strength, balance, and endurance have been slipping for a while, recovery has to rebuild those things from a lower starting point. When more of that capacity is still there going into surgery, the early months of recovery tend to feel more manageable, and people often regain function more efficiently. That doesn't mean people who wait and lose function don't improve. Pain relief after knee replacement is generally reliable, but functional recovery is more variable. Strength, balance, endurance, and confidence don't automatically reset just because the joint has been replaced. It's not a magic surgery. They need to rebuild, and that process is easier when there's more to work with. One area that deserves some special attention is strength, especially in the quadriceps, which is that group of 4 muscles on the thigh that controls the knee. Chronic knee pain is known to inhibit quadriceps activation, meaning the muscle doesn't fully turn on even when someone is trying to use it, and this has been documented across a wide range of knee conditions, including total knee replacement. Clinical research has shown that people often enter surgery with long-standing quadriceps weakness, and that weakness frequently persists into the early postoperative period if it's not addressed. Studies examining recovery trajectories after knee replacement consistently show that people who enter surgery with greater quadriceps strength tend to regain their walking speed, their stair function, and overall mobility more efficiently afterward. This relationship has been demonstrated in cohort studies examining early rehab and walking speed trajectories, where baseline strength and function strongly influenced how quickly people progressed, even though most individuals experienced meaningful pain relief over time. And balance matters too, and it's often overlooked. Knee arthritis affects joint position sense and confidence with weight bearing, which can subtly change balance strategies over time. Prospective studies following people after knee replacement show that balance does improve after surgery, but not always to age-matched norms, particularly when balance deficits were present for a long time before surgery. For example, a prospective cohort study by Chan and colleagues followed people for up to 6 months after knee replacement and found that more sensitive balance tests detected lingering balance deficits even as people reported functional improvements. And these kinds of findings help explain why some individuals feel unsteady or cautious well after their incision has healed, and why balance-specific training often needs deliberate attention during recovery. And endurance is closely tied to this as well. When activity levels narrow over time, overall conditioning declines, and that loss of aerobic capacity can make early rehab feel disproportionately exhausting, not because something is wrong, but because the body has adapted to a lower level of physical demand for a prolonged period. I want to pause here because this is often the moment where people hear risk and feel pressure, and that's not the goal. This isn't about convincing you to move faster. It's about helping you see the trade-offs clearly so you can decide what matters most to you. So here's a question I often invite people to consider. Is waiting right now helping me to preserve strength, confidence, and function? Or is it costing me some of those things? Another way to ask that is, if nothing changed for the next year, would I feel okay about where my body is headed in terms of my knee and my strength and my function? Some people realize as they reflect that waiting is still working for them. They're managing symptoms, staying active, and protecting their future capacity. And I've known many of those people who do wait, and they do stay strong, and they might even build some strength. For others, there's a different realization. They notice that their routines are shrinking, that they're relying more on others, and they don't quite recognize how they move anymore. They're moving differently. When that happens, surgery often shifts from feeling like a last resort to feeling like a reasonable next step. And that shift isn't about giving up. It's about choosing support before more capacity slips away. It's also important to acknowledge that waiting doesn't happen in a vacuum. Access to physical therapy, social support, geography, insurance, and life responsibilities all shape how people manage knee arthritis over time. If your waiting hasn't been as active as you'd like, that's not a personal failure, it's a reflection of real-world constraints. Also worth remembering that deciding when to have surgery is only one part of the picture. Many people are simultaneously weighing what kind of surgery they might need, whether a partial replacement is an option, how robotic-assisted techniques fit into the decision, or whether newer approaches actually change recovery in meaningful ways. And those are separate decisions, and they don't all have to be resolved at once. If you're exploring those questions, I've covered them in other episodes of this podcast, so go ahead and do a search, and you can listen and gather some more information without feeling like you need to decide anything on the spot. So if you're in that in-between space, unsure whether to keep waiting or moving forward, I encourage you to stay curious rather than critical. You might ask yourself, what would staying ready look like for me right now? What support would I need to maintain or rebuild strength? What am I hoping waiting will give me? And what if I'm afraid it might take something away? As you're thinking through these questions, it's important to bring them back to your surgeon as well. Your surgeon knows your imaging, your joint structure, your overall health, and your surgical options. Talking openly about what they're recommending for you and why can certainly help put everything into context and make sure your expectations and their plan are aligned. Knee replacement is not a race, and readiness is not a single moment you either catch or miss. It's a moving target. The goal is not to make the perfect decision, but to make an informed one that aligns with your values, your goals, and the life you want to keep living. As we close today, I want to leave you with this reassurance. Wherever you are right now, waiting, preparing, or moving forward, you're not behind. Readiness can be rebuilt. Preparation is not all or nothing. And clarity tends to come not from pressure, but from understanding the trade-offs and choosing deliberately. If you want help organizing your own thinking outside of this episode, my Total Knee Success Game Plan book was created for exactly this purpose. It walks through how to prepare, what to pay attention to, and how to make decisions at your own pace without rushing yourself toward surgery or away from it. And it's the game plan for preparing for a knee replacement. You can also find additional resources, episode links, and education at totalkneesuccess.com. Everything there is designed to support you in becoming an informed participant in your care. Whether surgery is months away, years away, or still just a question you're sorting through. Before we close, I want to remind you that this podcast is for educational purposes only. It's not medical advice, and it's not a substitute for individualized recommendations from your surgeon, your physical therapist, or others on your healthcare team. Decisions about knee replacement timing, type of surgery, and rehabilitation should always be made in consultation with your own providers who know your specific situation. In our next episode, we'll talk about what actually matters before surgery and what doesn't, so you can focus your energy where it truly counts. Until then, be kind to your body, stay curious about your capacity, and remember that this decision is yours to make. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.